Babesiosis Explained, a Southeast patient's guide to diagnosis and care. Babesiosis is unusual among tick-borne illnesses in the Southeast because it is not caused by bacteria. It is a parasitic infection that targets red blood cells, much like malaria. Cases were once concentrated in the Northeast and Upper Midwest, but the CDC now reports confirmed cases across Florida, Alabama, Georgia, South Carolina, North Carolina, and Virginia. Most healthy adults recover well with treatment. The disease becomes more serious in patients who are older, immunocompromised, or have had their spleen removed. What babesiosis is? Babesiosis is caused by parasites in the Babesia family, most commonly Babesia microti in the United States. The parasite enters the bloodstream through the bite of an infected black-legged tick, Ixodes scapularis, the same tick that transmits Lyme disease and anaplasmosis. Once inside the body, Babesia invades red blood cells and reproduces inside them, eventually causing the cells to burst. Less commonly, babesiosis can also be transmitted through blood transfusion, which is why it is now one of the few tick-borne pathogens routinely screened for in the U.S. blood supply. Symptoms. Symptoms usually begin 1 to 4 weeks after a tick bite, though they can take longer to appear. Mild cases may pass for a bad flu. Common symptoms include fever, often with shaking chills and drenching sweats. Severe fatigue. Headache and muscle aches. Loss of appetite, nausea. Dark urine, a sign of red blood cell breakdown. Severe cases can involve hemolytic anemia, jaundice, low blood pressure, kidney failure, and respiratory distress. Babesiosis is especially dangerous in people without a spleen, asplenic patients, patients on immunosuppressive medications, adults over 50, people with chronic liver, kidney, or heart disease. Visit the link in the description below for more information.